For more than 25 years, I've promoted the Hudson Valley Renegades. But you know who were the first Renegades? The founders who fought for our independence.
That's right, Zoles. This is County Executive Mark Molinaro, and we'll celebrate those original Renegades on July 4th when Dutchess goes Renegade. We're proud to partner with the Dutchess County Fairgrounds, Silo Ridge Field Club, iHeartMedia of the Hudson Valley, Central Hudson Gas and Electric, and your very own Renegades to present 3 fireworks displays across Dutchess County. Join us at Dutchess Stadium in Fishkill, the Dutchess County Fairgrounds in Rhinebeck, and the Silo Ridge Equestrian Center in Amenia for a nighttime spectacular that will light up the sky. Gates open at 7:30 p.m. and fireworks begin at 9:30. Parking is limited, so arrive early.
Our friends at iHeartMedia of the Hudson Valley will pump out the patriotic music and broadcast the events across its family of stations. I can't wait to see everyone on Independence Day to celebrate our community and our country. You know, it's been too long, Mark. I've missed you, buddy.
I've missed you too, Zoles, but I know I'll see you on July 4th when Dutchess goes Renegade. Okay, thanks everybody. Thanks for joining us. We are back live today. This is the second to last week that we'll be on twice. We have, as you know, we've been regularly Wednesdays and Fridays. Next week, ahead of the 4th of July weekend, will be Wednesday and Thursday. And then after the 4th of July, we're going to be on Wednesdays for a regular update, and then we'll advise you if there's any additional information. Today, we're at LaGrange Town Hall with Supervisor Alan Bell. Alan has not gotten a haircut yet, so just wanted you to be aware. We have worked together, the municipalities have worked together, all 20 towns, 8 villages, and 2 cities, these last 100-plus days seamlessly. It's been a collaborative effort. A lot of work to respond to your concerns and to respond to the pandemic locally. Before we talk a little bit about what's going on here in LaGrange, let's pull up the dashboard numbers so that you know where we are. Very promising. We're I'm consistently making good progress. To date, Dutchess County has administered over 55,000 tests with 4,176 confirmed positive cases. Today we are tracking 195 active cases. It's among the lowest since really the true onset of the pandemic. We have 5 individuals in hospitals. That's the lowest number since we've been tracking COVID-related hospitalization. And sadly, as we've mentioned, 151 individuals have succumbed to the disease. But overall, the data is good. Residents have responded. And we continue to see this downward trend. The transmission rate is low. New York State now still maintains among the lowest transmission rates of any state in the country. We'll get to some of the details, but Alan, while we're here in your town hall, I know that a lot of residents have sort of gotten somewhat used to the change in the way government is providing services. But why don't you talk a little bit about what folks should expect if they want to access town hall? And then some of the other activities going on.
Sure, thanks. This has been a challenge for us to run the government with the pandemic, as it has for all the rest of the layers of government and businesses in general, of course. Our town hall remains closed to the public for the most part, and that's been true since the beginning. There were real challenges when it started because the instructions also required us to have a minimum staff in the building and try to maximize the amount of work they were able to do from home. Some of our departments that adapted to that rather well, and others not so much, mostly because of the difference in the nature of the work. But our staff is almost entirely back into the building now, and we're working. I've been very, very surprised at just how much of the work we can do with the public over the telephone, via email. We weren't really set up to work out that way in general, and the fact that we adapted to it quickly has been a testimony to both the staff and the public, frankly. They've been a lot more cooperative and tolerant of that than I might have anticipated given the circumstances. But that's worked well. And I'll give you a good example. One of our judges performed a wedding via Zoom today. So that's an example of things being adapted and working well. Access to the building is possible for people who need to come in to do things physically by appointment. They can call any of the departments and make an appointment to come in here if they have a reason to do it that way. So we're operating pretty successfully right now and handling requests. We've got some challenges mostly in our building and zoning department because the requests are up massively as a result of two things. I think people being cooped up at home for a long time decided to take on projects they've been putting off for years, so we have a lot of that going on. And of course, constraining the general commercial kind of construction for a couple of months has resulted in there being a huge influx of that as well. So they're trying to keep up with that, but there's a backlog and things are taking a little bit longer than normal. But other than that, we're functioning pretty well. Our parks are all open and operational with some limitations based on guidelines out of the state, primarily in our Freedom Park where the waterfront is controlled in terms of the number of people that can be in there and that kind of thing. But most everything else is open and operational. We're working with our leagues to get back on the field for competition in July. And so things are moving along pretty well on that front, really.
And it's not unlike most of the municipalities. You've all had to kind of reorganize the way you deliver services. Right. We were talking before, and you mentioned it, the amount of services that maybe you can still provide via virtual or use of technology as a means of continuing to provide services, even when we're sort of fully functioning, is something I know you're all kind of confronting.
True. We're not quite sure when the building's going to actually open in earnest to the public, but the quick answer to that is when we've put all the precautions in place that we feel we need to. We're in the process of installing plexiglass barriers and that kind of thing, so that when we open up, we can make sure that we have social distancing and hand sanitizers available and that kind of stuff. That kind of thing has been a challenge to get in order, but it's coming in and we're getting ready.
So this will surprise you that there are folks who have been waiting to ask you questions.
Really?
It's always nice when they don't point them at me. Okay. You kind of mentioned it, but Dave asked about the LaGrange parks. All parks are open with the limitations at the waterfront.
The parks themselves, for the most part, have all been open from the beginning. The only exception to that was Freedom, which is where our lake was. That was closed initially, but it wasn't closed because of COVID. It was actually closed because we had construction going on in there, and we didn't feel it was safe to have it open to the public. But they're all open for everything now, including playgrounds. Everything is open. The only real restriction has to do with the capacity at the lake, which has to be operating at 50%. And I don't know whether that's actually been an inconvenience for anybody to date, but everything else is open, yes.
So June wants you to know that Regina in the building department has been very helpful. Do you have a Regina in the building department?
Yes.
And she's been very helpful.
I can't tell you how happy I am to hear somebody say something positive about, any
She didn't say
really,
you were very helpful. She said Regina.
I appreciate that. Our building staff is, as I said, that department has been just swamped for a couple of months now. Yeah. And they're doing fantastic work, and I appreciate the fact that somebody notices and appreciates it.
Well, and
I'll make sure I pass that on to her.
And one more for you. Fit for Mom loves and appreciates LaGrange and your town staff.
I appreciate that.
Yeah, so I know that they do some activities in your parks and I think on the rail trail as well.
Yep.
So,
I think that's right.
So if you're watching now and you have a question, just simply write it in the comment section underneath the live feed. We'll try to get to a few more. Alan, I'm gonna. It's up to you. You have anything else you want to add before we
Nope.
get into the?
I think that's it.
You're good.
Yep.
Okay, so we're gonna run through. Thanks a lot. I won't shake your hand.
Those are the rules. Thanks. I appreciate it very much.
You're very welcome. Thank you. Thanks for hosting us today. Patricia asked, when will wedding venues be allowed open? There's still no direction yet from the state. Some of those locations can. We've asked if, for instance, it was just simply this delivery of food, the service of food, if that could happen similar to a restaurant, but yet the state has not provided direction on that. What happens after Phase 4? Does it last for 2 weeks? Lori, Phase 4, as best we can tell, is moderately indefinite, and I don't mean to say that like we know. The goal here is to monitor the transmission of the disease, and as we've sort of finished this phased reopening, as the transmission stays low and if hospitalizations remain low, you would likely see some of the restrictions within those phases lifted. But again, the state's going to continue to monitor and make those decisions as we move forward. Janet asked about the Poughkeepsie DMV, still busy. All I can tell you is the Department of Motor Vehicles is a state agency run by the county clerk. I know that they're trying desperately to keep up. There's a huge demand with not a lot of, there's not new resources there. So please be patient. Please continue to try to call. I can tell you that Brad Kendall does respond, but I apologize. It says that you've been calling regularly for 2 weeks, and that you shouldn't have to worry and take that long to get a response. So keep at it. We'll advise the county clerk's office regarding the concern. Andrew, why are contact tracers not asking if you attended a protest? Well, I don't know that they're not asking. They're obviously first responding to a positive test. So if you've tested positive, there's likely some basic information that they're aware of, and then they ask who you've come into contact with. So they are asking questions that would lead you to a conclusion. And there's no prohibition on asking, did you attend a protest or not? But again, we get the positive cases. A contact tracer reaches out to a positive case, asks them how they may have contracted the disease, whom they may have come into contact with, and they've identified then those individuals, and we try to reach out and communicate to them as well. Are yoga studios part of Phase 4? Are they classified as a gym? At the moment, they are. So what we've said to the state is we understand that you're still reviewing the data. We'd like to see the data. You should see the data. You're still reviewing data as it relates to gyms, movie theaters, malls. We have asked that there are certain fitness and personal care businesses that could open that aren't traditional. They're not gyms per se, and they could function in a low-risk environment. And the reason we know they can function in a low-risk environment is because the basic service you provide has already been identified as a low-risk environment by the state. So we are asking that they provide guidance to allow for like small yoga studios, some of the the CrossFit kind of activities, even some of that work indoor or outdoors, and so we're asking for that to happen. The state has yet to provide that guidance, and they have not yet given the go-ahead. Let's jump through some additional news. Remember, we began Phase 3 on Tuesday. We're in this Mid-Hudson region, began Phase 3 on Tuesday. Personal care businesses. Today, in fact, the Dutchess County Regional Chamber of Commerce is part of our business notification network. We were joined by Senator Sue Serino and I, and we were providing PPE for personal care businesses. They were able to open sort of full, if you will, although with certain precautions. Tattoo parlors open. That's all in the Phase 3. Phase 4, the Mid-Hudson region is scheduled to begin Phase 4 on July the 7th, Tuesday, July the 7th. And within the category of businesses now expanding that opening would include higher education, what's identified as low-risk indoor and outdoor arts and entertainment, museums, zoos, historical sites, botanical gardens, aquariums, agritourism. So some of those, what the state identifies as lower risk tourism destinations and destinations overall. That is enabled to proceed, media production enabled to proceed, which, by the way, is a large business operation here in Dutchess County, and so film and video production will be able to proceed with certain restrictions. Earlier in the week, as you know, so within that Phase 4, we had been advising, based on the state telling us to advise you, that gyms, malls, and theaters would open when we commence Phase 4. That determination was changed. The governor made an announcement earlier this week that they're holding malls, gyms, and theaters at this point, still trying to identify guidance for those to happen and those to open. So the good news is that we are not yet in Phase 4. We expect, and I asked specifically the council from the governor's office, could we see, or would we expect to see guidance on those businesses ahead of phase 4. We expect to. So we expect to see some guidance ahead of the time the Mid-Hudson region enters phase 4 on July the 7th. However, there are regions of the state that have already entered into phase 4 today, and malls, theaters, and gyms, not yet any guidance on them. And understand, please, we are not suggesting that we should be risk takers here. Public health is very, very important. Our commissioner of health is an infectious disease doctor, quite schooled and certainly experienced in the transmission of communicable diseases. And so we're not asking for us to be unsafe in any particular way. We do think, though, that there are certain businesses in a mall setting that could open with appointments, for instance, hair salons and things of that nature. You might not have the full mall open, but there are small businesses where, again, maybe by appointment or curbside, there could be some capacity to open. So the state is yet to issue guidance on that. Earlier, and actually I'll answer Joe's question. Joe asked about bowling alleys. Yes, there are plenty of spaces in a bowling alley, Joe, but the state has specifically identified bowling alleys as one of those that are still waiting for approval. So we assumed, I shouldn't say we assumed, we were told that they would open in phase 4. So we're waiting for that guidance. Now, earlier in the week, the governors of New Jersey, New York, and Connecticut announced a travel advisory. That travel advisory says basically if you've traveled to or traveling from any number of high-risk states, they've identified Alabama, Arkansas, Arizona, Texas, Utah, North Carolina, South Carolina, and Florida. These are all posted on the New York State website as higher risk states because of the higher rate of transmission. If you've traveled there or you vacation there and are coming home or you're traveling from there, the state is asking that you self-quarantine for 14 days. And again, it's a self-quarantine, but if you violate that and choose not to, individuals can be subjected to fines for not complying, and that is the state order, and we're certainly going to ask you to be safe about monitoring and watching and complying with that guidance. So that's what's been included. As I said, we don't know yet when guidance should be expected for malls, theaters, and gyms, including amusement facilities. We're pushing for that, as I've mentioned, trying to get you some answers on that as well. Leanne, if numbers spike, do we go back to phase 1 or phase 2? Well, the short answer is no one knows. If the numbers go up, if you use any other states as an example, and you can use them as both good and bad examples. For instance, the state of Ohio has been incremental in its reopening. Amusement parks are open in Ohio. We haven't seen a spike, if you will, in Ohio. But then if you point to states like Texas or Florida, certainly there has been a rapid increase in the number of cases. In fact, I think in Texas today, I'll be careful not to offer information I don't recall entirely, but I think they're taking steps to restrict elective surgeries because hospitalizations have been on the rise. They have sort of slowed the reopening or have taken steps to scale back certain segments. So where there'd be higher risk, I wouldn't suggest that if the numbers go up, we go backwards in phases. The expectation would likely be that there are higher risks businesses or business types that might be where the transmission is coming from, and you can envision that the state would restrict those. So the good news is that we have taken the steps necessary locally to slow the spread of the disease. We believe that we know we've made good progress, and that we're obviously in this slow and steady process of reopening. And we are balancing the public health risk against certainly financial, economic, and mental health risks of remaining closed and keeping things closed. The state's making these decisions. We're reporting them to you, and working as best we can to coordinate with local businesses, with municipalities, to not only be safe, but to try to get people not only protecting lives, but getting back to living our lives. So we'll keep you posted. Right now, no indication of increases in transmission rate or even cases. You'll see in our dashboard only a handful of new identified cases, not for daily, not for lack of testing. We have very extensive testing. I would offer this, and I think this is important. We embrace the concept of having broad access to testing. It is a mistake for the federal government to scale back funding for testing. I know several days ago it was announced that the federal government was considering, and in fact may limit federal support for testing capacity nationwide. That is a mistake. Testing ought to continue, and the access to testing. In Dutchess County, there is broad access to testing at healthcare facilities, at doctors' offices, and of course our public testing, along with access to testing at pharmacies. So we're keeping this robust testing infrastructure available so we can monitor, and we are monitoring, and we have seen, again, a steady decline, and we're holding those numbers at bay. Cindy is back just to ask, she shouldn't hold her breath for her August wedding. Well, I wouldn't suggest holding your breath, but I do think that there's a capacity to have an August wedding. I don't think you should rule that out at all. We do believe that there will be access to wedding venues, just as there would be access to, for instance, church and houses of worship and religious ceremonies, just as there's been access to graduations, even in person. So again, from our perspective, don't at all rule that out. We believe that there will be guidance for businesses to provide and support weddings. So please don't get nervous about that just yet. We believe there will be guidance coming out soon, and we do believe that there will be opportunities to have more traditional weddings, but with limitations. You should be expected with limitations. Joe from Northern Dutchess Archery. Hey, Joe. I go by Northern Dutchess Archery when I'm running often. When or in what phase can we increase the number of people allowed in the store at one time? Well, you have a small store. Capacity is 50% now in retail. So 50% currently in retail. And I would expect that as we extend into phase 4, you'll see those numbers change if we can hold those transmission numbers down. But you should be at 50%. So, to the extent you can filter that through the business, that'd be the answer to that. If you're doing classes and camps and things of that nature, there are different sets of rules, and you'll want to ask, because I think I know that you do training programs there. And there's a different set of rules for that. So if you want to reach out, and I say this to any business owner, if you want to reach out to Ron Hicks, Assistant County Executive for Economic Development, the way the state is establishing these rules, these guidances, is to attach your industry code. There's a national industry code for every business type, and they attach that business code to a guidance. And the reason I say that is because some of what you offer, in particular if you're a retailer that may have classes or training programs or other activities, you have different guidance for different sets, for different segments of your business, and we'd be happy to help you figure out whether or not one aspect of your business might be able to operate at a higher capacity than maybe another one, and we try to make that happen quite often. So Ron Hicks, you can reach him through the Dutchess Business Notification Network, or Think Dutchess Alliance, or certainly just reach out to us at the County Executive's Office and we'll connect you. So that's information for you. If you have a question, please ask it in the comment section below the live stream. Sue's asking if there's any word on schools. The short answer is not yet. I do still believe that there will be traditional school activities that occur this September. Other states, Connecticut, I think just recently made that clear that there would be school activity. I believe New Jersey has said something similar. School districts are being asked by the state education department to sort of survey, see what families are interested in. I will say, and this is my opinion, we are comfortable with our kids going back to school in September. We believe that there ought to be certain precautions for at-risk or higher-risk staff and individuals. And I would say to you, we support the concept that for certain individuals who going to a school setting may not be something they can do because of an underlying illness, then continuing to provide some virtual access for that population, higher risk, what have you, certainly would make sense, but no word yet. KT, are state and city parks open in Poughkeepsie and Wappinger? Yes. First of all, no municipal park closed entirely. Parks remained open. However, sections of those parks may have been closed, playgrounds, basketball courts, what have you. All of the parks and playgrounds are open in the city of Poughkeepsie. I know that for certain. If somebody from the town of Wappinger is watching and wants to confirm that all of your playgrounds are open, but all town of Wappinger parks are open, I believe all the playgrounds are open as well. If somebody's watching from Wappinger, you want to clarify, please feel free to say so. But yes, those parks are open. County parks are open, and state parks are open as well. My family and I were at a state park, so we know that they are open. So, Justin, what's the deal with water parks? How can the governor close them if they are scheduled to open in Phase 4? Justin, the governor was given exceptional authority under first the state constitution, and then this March the state legislature granted the governor even greater authority to make these sort of directives. And so under his emergency order, it has the force of law. They are able to restrict the opening of certain business types. That has been what he's been doing these last several months. Now, water parks in particular, as I said, we believe, based on, again, metrics and data, we see what's going on in other states, and we've pointed to, in Connecticut and New Jersey, by the way, Connecticut and New Jersey will have all of their amusement parks, including water parks, open by July. We don't yet know when they'll open in New York. Water parks have been studied in Ohio in particular, and I point to that state because they have a good number of water and theme parks. No indication of water parks being this term super spreader, an area where you see significant spread of the disease. One of the reasons, of course, is that you're in a highly chlorinated and somewhat and certainly clean environment. That said, the concern has always been the group congregation around. However, again, we're monitoring the data. There is no indication that a water park facility, different than other amusement parks, but a water park facility is a higher transmission or a higher risk concern in the areas that have them open. We do know there are environments that we're concerned about where close proximity, like bars in states that have opened, those have become sort of petri dishes, if you will. And so that's the concern that many have had, and that's what they're trying to address in those states and what's being addressed here in New York. So we believe water parks should open with Phase 4. We believe that Splashdown in Dutchess is prepared to open the weekend of the 4th of July. However, we don't yet have guidance, and that's what we're waiting for. Now, we've asked, and we continue to ask every day for that information, and we are going to continue to press. There are a number of counties that have water park facilities. We're all talking to one another and trying to get the state to pay attention to that concern. So we'll keep you posted on that. Let's highlight a couple things that I think might be of interest. When we began this effort, responding over 100 days ago, we had this organization called the Medical Reserve Corps. Dutchess County's Medical Reserve Corps is we're one of a national network with, when we started, hundreds of volunteers. You have really stepped up. Dutchess County residents came to the Dutchess Responds website, you participated in our Dutchess Respond effort, and you volunteered. We have exceeded now 1,000 members to the Dutchess County Medical Reserve Corps. So that means over 500 individuals have joined since the pandemic began. We really have seen the MRC step up in so many ways, from assisting us with contact tracing to preparing for the test sites, to assisting and responding to community concerns, the hotline that you've been calling, staffed by members of the Medical Reserve Corps. And so in 2019, they had already set a record. They set the record for 4,200 volunteer hours. And so last year we set our record, 4,200 volunteer hours. In the first 6 months of 2020, Medical Reserve Corps volunteers have clocked over 5,000 volunteer hours. Everything from delivering food from grocery stores and medication from pharmacies to, as I said, staffing, the contact tracing. We wouldn't have gotten to Phase 1 were it not for the Medical Reserve Corps, meaning that we needed to have 290 trained medical contact tracers Thanks to the Medical Reserve Corps, we have over 360 contact tracers identified and serving in county, serving the county. They've been making the rounds at our homeless shelter, at our temporary housing unit, at the Dutchess County Jail and Law Enforcement Campus, and they've helped us to assemble countless thousands of PPE kits that have been distributed all across Dutchess County. So we're grateful to the Medical Reserve Corps, in particular Joe Ryan, who leads the Medical Reserve Corps. Joe and I are Mets fans, so you should know that the governor has included in the Phase 4 activity that Major League or professional athletics, professional sports can commence. So far, the Mets have had the best season they've had in a long time. Not a loss, not a single loss. So that said, very thankful to the volunteers at the Medical Reserve Corps. Sarah, if someone is an essential worker, does the travel ban apply? We're still waiting for an answer. We believe, based on the conversation yesterday, that if you are an essential worker, you're requested to get tested and to monitor, but you may still be required to work. However, I will clarify that before we come to you live next week. So we'll get a clarification on that. And if we can just note Sarah's question, because we asked yesterday, and the answer on the call with the governor's staff was yes, if you're an essential worker, you go back to work. The travel ban doesn't preclude you from working. However, you should test and monitor. But we want to make sure that that's clearly articulated in the order, so I don't want to get that wrong for you. If you are also... by the way, the state identifies the exceptions on their website, so you can kind of go through that, so you can take a look. But also, if you are traveling and you do come back and you are self-quarantining, remember for certain business types and for certain conditions, the Families First Act provides a guarantee 14 days leave from your employment, so because of a local order. So please, if you have traveled and you fall within this travel ban requirements, make sure that you've talked to your employer to be sure that you know and they know what benefit that you're provided under the Family First Act, which was adopted by Congress earlier this year. If someone in my house travels to a high infection rate state, while they quarantine, would the family have to quarantine as well? Okay, so if someone travels to one of those high-risk states, as identified by the three governors of these three states, and is in your home, you are not required to quarantine. However, you should monitor, obviously, your health conditions. The individual who is self-quarantining should get tested. So if they believe they may have contracted the disease, they should contact a physician. They should go to urgent care. They can go to a pharmacy. And again, you don't want to do that immediately, but accessing a test is important, and then monitor symptoms. If there are no symptoms, then obviously you're at a lower risk of transmitting the disease. We know that. Absent symptoms, lower risk of transmitting the disease. And you go about your business. But if in fact the individual tests positive or starts to show symptoms, you should also be tested. And however, the quarantine the governor's order does not require you to quarantine if you're in the same household. Mike, does anyone know what's happening with gyms? Well, the short answer is not yet. The governor's office and the governor even said today on several media outlets that malls, theaters, and gyms, they're still studying. Now, what I'll say to you is that malls, theaters, and gyms were never going to open ahead of Phase 4 in the Mid-Hudson region. We do not enter Phase 4 until Tuesday, July 7th. We were advised by the Governor's Council on Tuesday of this week that there would be a delay in guidance for malls, theaters, and gyms. And that meant in regions upstate that were beginning Phase 4, they wouldn't open with them. I asked specifically, could we expect to see guidance ahead of the Mid-Hudson region reaching Phase 4? And might those businesses, malls, theaters, and gyms, open in the Mid-Hudson region concurrent with Phase 4? And they did not say no. And the reason I say that is because it does sound to me like they are working to try to come up with guidance. Our goal is to have that guidance in line when we start Phase 4. But again, we're waiting for the state to make that determination. Now, The governor has been saying, and I do want to say this out loud, that some of the hesitation for malls, theaters, and gyms has to do with air handling systems or HVAC, heating and air conditioning. That is a very, okay, so they're saying they're monitoring that. What I want to be clear about, and we've talked about this, is as of this moment, there is not some mathematical metric that suggests that malls in particular or gyms in particular have some HVAC system that is worse or even better than let's say, a large department or grocery store. The reason I say that is that our Commissioner of Health, and I asked again today, Dr. Anil Waidyan, who's an infectious disease doctor, will support the concept that this disease is not, you're not at a greater risk to transmit it simply because of an air handling system. And it is a little bit unfair, and I would offer a little dangerous to suggest that without the supportive technology or review of technology. This is all, it's a new disease, everyone is monitoring it. But we can point to transmission, and we do know that there's higher risk transmission in areas where you're spending a lot of time close in sort of close communication with you're talking with one another, you're laughing with one another. That is legitimate. But simply the fact that you're walking from the main entrance to the salon at the mall, the mall's HVAC system doesn't put you at a greater risk, and so. We're waiting for the guidance, but that's what the governor has come to say of late, and we're just telling you what's guiding their decision making, and we hope they get guidance for gyms, malls, theaters, and water parks ahead of the July 7 start of Phase 4 in this region. So mindful yoga, nothing changed with outdoor recreation for Phase 4. For both youth and adults. So outdoor recreation in Phase 4, no change yet, but to be clear, youth and adult recreation activity, low to moderate risk. Those have been identified. You can find them at our website, duchessny.gov. It'll take you to the New York Forward website. Low and moderate risk include baseball, soccer, I'm trying to think, field hockey, non-contact lacrosse, things of that nature, all included in low to moderate risk. You can begin practice and competition July 7 when we begin Phase 4. Higher risk, basketball, football, contact lacrosse, can begin non-contact training. So if you're doing drills, I coach my son's soccer team. For instance, soccer can play. You can have drills and competitions, but contact sports like lacrosse, like football, like wrestling, like basketball, where you're in close proximity to one another for longer periods of time, you can begin the skills training, the training on July 7. Michelle wants you all to know that our American Sign Language interpreters are awesome. That's you. So, thank you. Did I do that right? Thank you. Angel, why do we pay legislative people? They should pull Cuomo's unlimited power. Yes, I agree. Why are you paying for state legislators? We agree that the time has come. The state legislature provided temporary authority to the governor to really craft law out of emergency order. We don't understand that executives like myself and the governor already had pretty significant authority once we declare a state of emergency. We are still in a federal and state and county declared state of emergency. Provides us some authority to restrict activity for the protection of the public health, safety, and welfare. The state legislature gave the governor additional authority this March. It is temporary, and we agree that I think taking that temporary authority away makes sense. That we're in a time now where we should transition back to that balance of power. In fact, I'll just say as a reference, our own county legislature, right, meeting their committee day, they'll be meeting in person. There's more regular legislative activities going on. That balance being restored at the state level makes sense. I want to tell you that I believe our state legislators generally agree. Senator Serino has been pushing for this as well. I do think it's time that the state legislature convene, have that conversation, and start the process of sort of weaving back and pulling back and reining back that authority. So you should reach out to your state legislator. You should tell he or she what you think. You should express your opinion. They should hear from you. They do have the authority to take back that temporary power granted to the governor. I promise you, this is not based out of any partisanship. I recognize I came in second place in 2018. This is not some fantasy that I'm concerned about. At some point, that very high degree of authority needs to be restricted because, again, there needs to be that accountability, that transparency, and that balance of authority. We have relinquished certain emergency orders over time because they're not necessary. The same is true at the state level. So thanks for that question. Mike, we answered. Jean Marie wanted me to just play up and again acknowledge Joe Ryan, who is, and we agree Joe Ryan's great as well. And the Medical Reserve Corps has been doing wonderful work. We also continue to reach out to provide services to those with mental health concerns, drug addiction. This county continues to operate the most comprehensive network of mental wellness services of any county in America. Whether it's the crisis intervention training in mental health first aid, or our trauma-informed care and ACEs training, social-emotional training with schools and individuals interact with young people, or our Narcan training. We continue to provide that virtually, Narcan training, and we certainly want to acknowledge the great work of our behavioral and community health staff who continue to provide that. If you read the Poughkeepsie Journal recently, a middle school teacher learned about the Narcan training during a conference with CAPE, and from that experience, she was able to make use of Narcan as a means of saving a neighbor's life. So critically important. And I will say this, and I read it all the time. We're in the business of saving lives. And so if Narcan saves a life, we administer Narcan. We don't ask you why you're dealing with drug addiction. You're dealing with drug addiction. No one chooses to be a drug addict. Nobody chooses to be addicted. But at the end of the day, yes, maybe a choice led them to the use of the drug. But our goal and our job here is to save lives, and every life has value. And the work that we do to train with Narcan is very, very important. We continue our virtual Narcan training the fourth Wednesday of every month. When you're done training, you receive a Narcan kit, so you have it available with you. And if you want more information, you can visit dutchessny.gov/Narcan. So that's some information for you. Joe, how many phases are there? I thought we were home free in phase 4. We agree what the governor's office has said, and I'll tell you, this is not what they said for the 21 days prior. Originally, we were told to tell you and to tell the malls, the theaters, and the gyms that you are all opening in accordance with Phase 4. Wedding venues, all opening with Phase 4. We were told that for 21 days. We asked the question often. We expressed it to you. I sat in front of you and told you. The state of New York is telling us to tell you that those open in Phase 4. On Tuesday of this week, the counsel from the governor's office said, well, for malls, that was never the intention, which is not true. Listen, what the governor has said is that there's some indication that there's some concern regarding malls, gyms, and theaters that they want to better study before they allow them to proceed. I am okay with somebody saying that there's an area of concern. But we do believe, and I've asked, as have our county leaders locally and across the state, just show it. Explain to the public more than some offhanded comments about air conditioning. Just show us where in the states that there's been problems that these are spreaders. Because again, if there's a concern regarding the proximity of people or the air handling in a system, well, that may have applicability with other businesses, and we would want to be sure that if there's risk in those businesses because of some model or concern, well, we'd want to be sure to be protecting others, and it's just not right. It's disingenuous to say that you weren't saying this for 21 days when the state was. So what they are saying is malls, gyms, and theaters will occur in Phase 4. There's no other phases, but these don't fit in that box, and therefore will be enabled to open sometime. We hope and expect to get guidance for those businesses ahead of when the Mid-Hudson region enters Phase 4 on July 7. Annette asked about malls. Same thing. And again, I understand. Somebody said yesterday on social media, you're whining about malls. We're not whining about malls. I understand the concept that we don't want people congregating. We don't want the social gathering. I know the toll of this disease as well as anyone. And what I can offer to you is that what we want to do is ensure that there's consistency in message, consistency in the application of that. Because, for instance, there are plazas with indoor hallways that are open. And they're open because they meet a square footage limit that the state has established. So my point being is, from our perspective, are there businesses, even some businesses in a mall setting, that could open? For instance, a hair salon. Could they not schedule, and just as you would for any other hair salon, schedule and allow people to come in only for their assigned appointment? Could you not have certain businesses available? Because right now, keep in mind that in a mall, the Target with the door that exits out into the parking lot is open, and they're mobbed. The Home Depot, very busy, and they're attached to a mall. I was going to say Circuit City, but it's not Circuit City, but you know what I'm thinking of. What's that? Best Buy, thank you, are open. You can access through the parking lot. Could there not be some capacity for certain businesses that maybe are smaller, certainly could function through an appointment? You know what they are in a mall. Could they not at least establish the ability to open for those purposes? That said, state hasn't issued guidance yet, and we're going to continue to work on it. Cindy, what phase for assisted living? What I would offer to you, the state has not yet issued guidance for visiting or accessing nursing homes and assisted living facilities. And as much as you and I would like to be sure that you get to see and visit a loved one, there still remains significant concerns about the disease entering into a nursing home. This state has already seen the most nursing home related deaths of any state in the country. That does not come because nursing homes aren't doing their level best. In this county, we've been very fortunate that our nursing homes have been providing really good care. They understand and know you want to see your loved one. Certainly your loved one wants to see you. There is and remains that concern regarding the severity of the disease and the ease of transmitting it in those settings. So now nursing homes don't fit in any of the phases. They're just waiting for that guidance. And I can tell you right up front, we recognize, and I don't want to mislead you, there is no indication that there is going to be some rush to get guidance out and allow visitations by the state. The state is still saying that this is an area of concern, and it is an area of concern, and we're going to continue to work with our nursing home providers to be as helpful as we can. We're going to continue to provide support to you as the best as we can, but we do not see nursing home visitations occurring any time in the immediacy, and we'll keep you posted on that. Cindy, I answered Susan, are you concerned with the number of active cases going up? Well, I'm concerned in the states that have seen that happen. We have not seen that happen. We have seen consistent decline in cases. We have less than 200 active cases in Dutchess. That's down even from several days ago when we were at 300 and 400 and 500. I am absolutely concerned about the cases and the growth of cases in states that have seen it, and I believe it's because they have not been as strident in offering guidance. We've been very clear with you. We continue to encourage the physical distancing. We continue to encourage the use of a face covering when you can't engage in physical distancing, and we have been very rigid with businesses in making sure that they have safety precautions in place. This county, as with any other across the state, has been implementing these changes, these policies, and that's a concern for us. What we've seen in other states, frankly, in certain states, is sort of a sort of a laissez-faire kind of attitude about the disease. That is a mistake. We've seen other states move forward only to close down. We know that the disease can be spread when you're in close proximity in sort of those dense populations, and that's why again there's a concern, and you'll see it in the southern states that are starting to see the positive cases go up. That in fact they're seeing cases among younger people because of the engagement that you're having, right, in social settings, bars, those kind of environments, and that's a concern, and we're going to continue to monitor that. But we are doing the right thing here locally. We want to continue to be safe. We also want to get people living their lives to the extent we can, and we've seen steady decline now here in New York and in the region. Linda's asking about catering events. Linda, again, we're going to continue to ask the state for guidance. We think certain catering facilities could function as restaurants do. You might not. We've talked about this before. If a restaurant can be at 50% capacity, well, maybe a catering hall could be at 50% capacity, but you wouldn't have some of those, sort of additional activities going on, right? It wouldn't be dancing and congregating of that nature because of the concern regarding the transmission of the disease. No guidance yet from the state of New York. Meg, how is the travel ban being monitored? Your guess, Meg, is as good as mine, and I mean that sincerely. I mean, this is the only time somebody said to me, you were at a loss for words. Meg, how is the travel ban being monitored? The state has not said how the travel ban is being monitored. This is a strong encouragement that you follow the ban. What the state governor has said is that the state will randomly audit itineraries, if you will, at the airports here in New York. I'm only saying that knowing that I don't know that the state has the legal right to do that. There's some issues regarding FAA and federal and state policy. I'll leave that to the state of New York. And then based on those random audits, the state has said that state officials might contact people who have been traveling. Again, there's certain privacy issues and FAA requirements, so I don't know that that's actually happening. So what I'm going to tell you is this. We agree, Dutchess County agrees, as do my colleagues locally, that if you're traveling to or from a higher risk location, when you come to a lower risk location, you should try to limit your interaction. And when it comes to these governor's orders, these 3 state governor's orders, please adhere to the order. If you're traveling from a location with a higher transmission rate and you're coming here, we're asking you to self-quarantine for 14 days. We are asking you to do that. I can't tell you that I know how exactly that's going to be monitored because no one knows how it's going to be. Well, somebody might, but not us. The health department is not in a position to do that. We are notified when you test positive, and then we engage in that monitoring with you, and that is the appropriate role for government and for us. So we'll keep you posted on that. Why are riots okay, but sports for children not okay? Jill, I've answered this several times. First of all, riots are not okay, period. We do not support riots. We don't support the destruction of property. We don't support the taking down of public property. There are processes for that to happen. You should engage in a civil discourse. John Kennedy used to say, had once said that civility in our discourse is no weakness. And so physical destruction of property is unacceptable, period. As it relates to protests, this is what I would offer to you. Yes, it is an exercise of your constitutional right. Protests are generally an emotional explosion, right? It's people responding in some way that there's limited control. That happens. And so while they're not necessarily permitted, they're not anything you're going to stop in its entirety. You're just not. Rioting and destruction of property ought to stop. That ought to stop. And law enforcement and others need to engage in the practices to ensure that happens, that those things stop. But protests and the exercise of freedom of speech is not something you're going to restrict in its entirety. It's like waves crashing on the beach. You can respond to it, but you're not going to stop them. Sports for children are organized by organizations. They're permitted by governments. They're enabled by organizations, and you have insurance for that. You're taking certain risk. And I've been asked this before. If a business were just to open today on its own, you don't need me to tell you to stay closed. You don't need me to tell you to stay open. But if you were open outside of the executive orders, you run the risk of one, obviously, transmission of the disease. Two, of not having any insurance to cover you. And we tell people all the time, if you think you want to make that choice, you should call your insurance company first, because they're likely to tell you that they will not provide you coverage, even slip and fall, if you are operating outside of some government directive that says otherwise. The same is true in this case. These organizations can't take that risk, and therefore they don't operate. But they will begin, as we said, July 7th, youth athletics can begin. Cindy asked about nursing home visitation, mentioned that as well. We have a few more minutes. If you have any questions, please feel free to type that in the comment section below the live stream. We started today's town hall by referencing our 4th of July activities. We are, as you know, Dutchess County hosting 3 fireworks displays simultaneous across Dutchess County, one at the Dutchess Stadium in Fishkill, one at the Dutchess County Fairgrounds in Rhinebeck, another at Silo Ridge in Amenia. And these are car-based, so we are celebrating Independence Day and the great promise that this country was founded on. And I never get tired of talking about it, so I apologize. But think about it. All those years ago, the founders of this country shouted across the globe that even though for generations and for time in memoriam, governments were created to govern the people, we would establish a government by the people, and that certain rights weren't granted by government, were granted by a creator, and those rights are inalienable and protected under the law. And so that promise, that declaration, has been something that we have strived to fulfill every day of our existence. This year, 2020, we're striving even more. And so, yes, if you don't agree with the restrictions the state has imposed, that is still an expression of our balance between individual rights and government overreach, and whether or not those fall within what we think is right in the law. The horrible murder of George Floyd and the outbreak and the reaction to that, the struggle that so many people of color continue to experience is an expression of that promise not yet being fulfilled. And so and by the way, law enforcement engaging in training and exercise to be balanced about how they enforce the law, that's an expression of not yet meeting that great American promise. That's what we're celebrating on the 4th of July. And come hell or high water, Dutchess County is celebrating the 4th of July with those those moments. So they're car-based. I have to tell you, no facilities. There are not bathrooms. We cannot open up bathrooms and have people congregate. So I understand that might not be very exciting for some of you, but if you want to celebrate the 4th of July, those 3 locations, we're doing this in partnership with Central Hudson Gas and Electric, iHeartMedia, Eastdale Village. We're thankful for your sponsorships. The Mitch Neshawat family, thank you for your sponsorships and the support of this event. It's all vehicle based. Parking is limited. This is carry in, carry out, so please don't make a mess. No fireworks. You cannot bring your own fireworks. You can only watch ours. And we'd ask you to comply with all of those. But we're going to have a great celebration. It's really an opportunity. We need you to stay in or near your vehicle. You can get out, stretch your legs, but please stay in or around your vehicle. A really important celebration for all of us at those 3 locations. So please join us. Eric, what can I do if my landlord is telling me to vacate? Currently, evictions are not being heard by the courts, and there is a moratorium, a stay on evictions. If you can pay your rent, you should pay your rent. If you can't pay your rent, you should try to work out some detail with your landlord. But I advise landlords, again, that evictions there's a moratorium on evictions during this state of emergency, and that has been extended by the governor's order, and therefore evictions cannot occur. And I would really caution you for if you decided to take advantage of that. And I will tell you, in Dutchess County, for renters and tenants, we do business with a number of organizations that provide tenant and renter rights and protections, and therefore, if you have a concern, please reach out to us at duchessny.gov. Happy to connect you. If you're a landlord and you want some assistance with a tenant, happy to try to provide some guidance. And if you're a tenant looking for assistance with your landlord, we do business with a number of organizations that provide assistance for you. Jim asked about who else is doing fireworks. Jim, I think next week, local media will start promoting that, and we'll be happy to add that to our promotion. I know the town of East Fishkill, Supervisor Nick D'Alessandro would want me to tell you that they're hosting a vehicle-based fireworks display, but again, that may be limited because of capacity, so we'll continue to update you on that. So, ladies and gentlemen, we've been with you for an hour. Thank you for joining us. We are scheduled next week at 3 p.m. on Wednesday and Thursday. So Wednesday at 3 p.m., Thursday at 3 p.m. You're going to want to join us. I promise you that we'll have some more updated information. We expect as we get into the 4th of July weekend, we'll be preparing for Phase 4. We'll have some additional information. We'll be promoting our town hall on race. It's a listening town hall on race and in Dutchess County and every town, village, and city will be participating. We'll be asking people, in particular, people of color in our community, to come forward to speak about your experience. We're going to use this to inform our efforts to make positive impact throughout the community. And for those, all of us, spend time listening. I've said this before. It's a real test of leadership, and it's a real test of who we are as a community when we spend time listening to one another. I also encourage that when you're shouting too loud, sometimes we can't hear you. And so therefore, using this venue, we're organizing this event, using this opportunity to listen to one another, learn from one another, and then to take that as a way of informing our decision making is so critically important, and we're going to engage in that. Give you some more information about that as well. As I said, next week, 3 p.m. on Wednesday, 3 p.m. on Thursday. After that, we'll be shifting to once a week, and we'll give you those details as well. Ladies and gentlemen, have a great weekend. In the meantime, stay well, be safe, and continue to be kind to one another.